guys, and welcome back to the channel. This week we're going back to my roots and we're talking about J-tubes. So if you're new here, hi, my name is Arena and I have a genetic connective tissue disorder which, among other things, has essentially shut down my GI system. So because of that, I have two feeding tubes. One is called a G-tube and the other one's called a J-tube. The one we're talking about today is the J-tube, which stands for jejunal feeding tube. Jejunal is another word for small intestine, so because my stomach's paralyzed, I needed a feeding tube that skipped my stomach and went straight to my small intestine. And so this video is all about what got me to this point, what was the surgery like, what was recovery like, whether or not I think it was worth it for me, and just all the details about my jejunostomy, which is the name for the surgery to place a J-tube. So yeah, welcome to the video. But before we get started, as per usual, every week I like to pick a comment from last week's video to react to. So this week I picked a comment from Meadow Margaret, which is a super cute username, by the way. And she said, "One thing I realized after hearing your primary care provider is that mine sucks. I have Medicaid and I can only go to the ones covered. All the ones in my area that I have been to are the worst. Sometimes my specialists aren't the great as well. None of them think about quality of life. Overall, I think my specialists run the show and my PCP doesn't want to do anything with chronic health conditions." I was paraphrasing a little bit, so if you want to read the full comment, go back to last week's video where I was reacting to Molly Burke and Dr. Mike's interview. But to get back to the comment, primary care doctors, in my opinion, are one of the most important doctors you can have as a person with a chronic illness. I definitely have run into doctors who don't want to touch chronic health conditions with a 10-foot pole. They're like, "You're too complex, I'm too scared to do anything with you," and they're basically useless. But I've also had so many amazing primary care doctors. I had one a few years ago that was a family friend who I loved. I have then moved to Montana and had one who literally came out of retirement to work with college kids and then got stuck with me, and he was the most amazing primary care and was honestly one of the most impactful doctors in my entire chronic illness journey. And then moving back to Texas, I got a new primary care doctor and he truly is single-handedly keeping me out of living in a hospital. Yes, I'm so appreciative of my primary care doctors, and once you find one that's really good, it really is such a game changer. Maybe they can't like do surgery themselves, but they are able to basically run the plays. If you think of chronic illness as like a football game, they're the quarterback. So they're able to look at your whole picture, your quality of life, and see what areas to prioritize and then to send you in the right direction. So even if they're not the ones directly prescribing or doing surgery or all of those things, they're definitely the ones who can really coordinate and run your healthcare game. So my biggest tip, if you're looking for a good primary care doctor, is to go on Facebook, and it doesn't necessarily have to be your specific condition, but that is helpful. But find a local Facebook group and ask for recommendations from people. I wouldn't rely on like Google reviews, because those reviews are usually the extremes of people who felt either really passionately that they loved this person or they really didn't. And so you don't really get the middle ground. But I feel like through like Facebook groups, people give a lot more honest reviews, and so that's how I found most of my doctors, was through Facebook groups and friends and referrals from people I know, rather than online reviews or just trusting a random referral. So that is my biggest life advice for y'all this week. So let's get back to the J-tube. Just for a little bit of background context, especially if you're new here, I have a condition called gastroparesis. Gastro means stomach, paresis means paralysis or paralyzed. So my stomach is paralyzed. So when I eat food, my stomach won't squeeze and contract and break down the food like a normal person's stomach would. And so the food will just sit in my stomach and make me really, really sick. Sometimes I will actually throw up the food that I eat. I can't eat a lot. And I basically spent 2, almost 3 years after being diagnosed with gastroparesis, where I was struggling so much with nutrition. I had jaundice, I was getting organ damage, I had really severe low blood sugars that could easily have been very serious. Nutrition is one of those things that I feel like is so often overlooked in healthcare, but makes such a huge impact. I was so sick for years with gastroparesis until finally I got a new GI doctor, and on her first appointment with me, she sent me to a surgeon to get a GJ tube placed, a GJ feeding tube. So a GJ tube is, actually, I have one, let me go grab it. This is actually a GJ tube that used to be in my stomach. But as you can see, it's labeled on the front, G and J. I don't know if it's focusing for you. So it's labeled G and J. And so this tube, I'll just quickly go over how it works because I think it's fascinating. And it's actually relevant for the rest of the story too. So this tube this is the part that you'll see outside of your stomach. So this is the GJ tube that's currently in my stomach. It's a different brand, but it does the same thing. So as you can see, there's just this little piece of plastic that sits outside of your stomach. And imagine my hand is my abdominal wall. So the tube will go into the stomach, and there are 3 holes here. And this is the G port. G stands for gastric, which means stomach. So this goes in through the abdominal wall and sits in the stomach, and these 3 holes give you access to your stomach. And then this long part is the J portion. J again stands for jejunum, or small intestine. And so this long part is threaded from your stomach into your intestines, and then it sits further down in your intestines. So I would use this, and I would use the long J part to get feeds and medications into the part of my GI tract that was still working. And then this part I would use to be able to vent things like excess air to help with bloating and nausea, in what we call venting or draining. And so on the outside, it's got these little ports, and then you're given these extensions in order to be able to access the feeding tube, and it just pops in like that, and then now you're able to use the feeding tube. So that's how the GJ tube worked. And so for about 2.5 years, I just had the GJ feeding tube, and it worked great. I didn't really have very many issues. I think it only flipped once in that timeline. But then about 6 months ago, I started having a ton of issues with it. So it's November of 2025 right now as I'm filming, but back in June is when I first started having problems. So the first issue I had was actually while I was in Minnesota with a friend who was going to the Mayo Clinic for her own health issues. And while I was there, I started noticing that my medications didn't seem to be working like they used to. And I was really confused why they weren't working. I thought, oh, maybe my intestines just aren't absorbing as well. I also have malabsorption issues. So for a few days, I just kind of assumed that was the problem. And then finally a few days go by, and I'm like, I'm really starting to get sick. Like, my medications are not working at all. So I kind of wondered, maybe this feeding tube has flipped or kinked and it's not working properly. So I went to the Mayo Clinic ER, and they did imaging, and they actually admitted me overnight because I was having so much pain and nausea and vomiting and bloating. It was just horrible. So they admitted me and then got me to interventional radiology the next morning, which was incredible. The Mayo Clinic scheduling department is so amazing. They were so fast. Everyone was super nice. So it's definitely a 10 out of 10 experience. But when I got to interventional radiology the next morning, they took pictures of the feeding tube, and it was flipped, but it was also kinked and twisted on itself. So somehow my intestines and my stomach had ejected the tube out of my small intestine back into my stomach, and it was just doing backflips in my stomach. And so I actually have the x-ray of it. I'll put it here. The Mayo Clinic replaced my GJ tube, got it back into its normal place, and I got discharged, and I was like, whew, all done, all good, all fixed. A few days later, I got home back to Texas, and I woke up one morning, and I looked down on the floor, and to my great surprise, I found this exact feeding tube on the floor. My feeding tube had somehow in the middle of the night fallen out of my stomach, which is crazy, and it was just on the floor. And if you don't have a feeding tube, you might not know this, but if you don't have something in the stoma or the hole in your abdomen where the feeding tube goes, it will close super fast, like within hours. It's like an ear piercing. If you just got your ears pierced and you don't wear an earring, it's gonna close really fast. So the same thing is true for feeding tubes. If you don't have something in the hole, it could close, and I would need a whole new surgery to get another one placed rather than just switching it out like I normally do. So instead of driving the 2 hours all the way to Dallas, where I am normally able to get my feeding tubes replaced, I went to my local ER, which doesn't have the capabilities to place a GJ tube, but they were able to put just a short little G tube in the hole just to hold it open. Even just in the hour that the feeding tube was out of my stomach stoma had already started to close a lot. And so it was super bloody when they put it in. It was really painful. So yeah, it was definitely a good choice of me to go to my local ER rather than driving 2 to 3 hours all the way to Dallas, because by then it might have been all the way closed and I would have needed a whole new surgery. So I got this little G tube in place, holding the stoma open, but obviously just having a G tube without the J portion, I still can't use it for medications, which are really important for things like blood pressure and hearts and all kinds of other issues that I have. My medications are super important. So then the next morning, I was planning on driving up to Dallas, but when I got up, I looked down and the G tube had fallen out too. I don't even know how I had 2 of those fall out in a row. It was insane. But because it was a short little G tube, I was actually able to put it back in myself, which was crazy. But I finally went to Dallas and I said, my feeding tube fell out today, it's broken, I need a new one. So I was admitted and they got me in a few days later to get a GJ tube, and I went home and everything was fixed again. And then probably a week later, again, I started noticing that my medications weren't working. And this time I also noticed that I was tasting my medications, or anything that I was putting through my tube, I was tasting. I have really, really bad reflux. If I take anything by mouth, it almost just immediately comes back up. Sorry, that's like kind of gross. But since I was putting medications through the J part of my feeding tube, I shouldn't be able to taste it because it should be in my intestine. So I drove all the way back to Dallas that day, showed up, and I said, I think my feeding tube's flipped. They did some imaging and they confirmed that it was flipped again. So I got admitted and then got my tube replaced. And so the day I got my tube replaced, I was able to go home, and that night I was doing my medications again and I started tasting them again. And my feeding tube had already flipped less than a day since the last one got placed. By now I've been to the ER so many times, I'm fed up with it, so I just called interventional radiology directly and I said, my feeding tube is flipped again, I need to be scheduled to get it replaced. They scheduled me within a few days. Thankfully, I was able to go get it fixed. They replaced it. As soon as I got home, again, I took some medication and it was already flipped again. So I called IR again. They scheduled me again. I got it replaced, and this time, while I was in the car on the way home, it had already flipped again. So my feeding tube is not staying in place. It's flipping constantly. So one of the ways that the J portion of the feeding tube can be flipped is if you throw up a lot, the force in your stomach can kind of pull the tube up as you're throwing up. And that's one way, and probably the most common way it can get flipped. But the last 2 times it flipped, I hadn't thrown up at all. And so the other way that a feeding tube can be flipped is through something called reverse peristalsis. I'm not saying that right, but essentially if your motility in your intestines is either completely dead, which mine is very impaired, or if it's really erratic, it can actually start working in reverse. And so instead of pulling food down through the tract, it actually starts pushing things back. So that's what we think was happening in my intestines, which was causing these feeding tubes to constantly be flipping over and over again, is that my intestines were actually so bad and the motility was so erratic that it was forcing the tube back into my stomach and essentially just like throwing it out of my small intestine. And so even if we kept replacing the GJ tube, it was just going to keep flipping. It's not going to stay in place. And so I called my surgeon and I said, it's flipping constantly, I don't know what to do, how can we fix this? And he said to go to the ER and get admitted. So I went to the ER, they confirmed it was flipped again, and instead of replacing it, they called my surgeon, and my surgeon said that he wanted to place a J tube. So the same way you can have a G tube, you can also have a J tube, which does essentially the same thing. It just goes through the abdomen straight into the intestine rather than going through the stomach and getting threaded into the intestine. So that's what my surgeon did. He used what's called an open Witzel technique, and basically he opened up my stomach and then used part of my intestine to create a little tunnel for the feeding tube to sit in, connected that to my abdominal wall, and then threaded the new straight J tube into my stomach. I really didn't want to get a J tube, but I also knew that if I just kept getting GJ tubes, one, it was flipping within hours of getting placed, so I wasn't able to use it at all. I was having to be admitted so many times just to keep me stable because I wasn't able to get medications. And so at this point, getting a J tube was necessary. The surgery itself was really not too bad. It was about an hour long, and like I said earlier, it was an open surgery. So instead of using little cameras and tiny little instruments, they actually made an incision down my abdomen and opened up a pretty large space. And from there he went in, rearranged my intestines a little bit, and then put the feeding tube in. It took about an hour, and I can show you all the scar from it if you want. Here's this little purple scar that goes from here around my belly button and down. It's actually a pretty small scar for being an open surgery. I've seen some that go like all the way down the abdomen, which is crazy, so I'm super thankful that he was able to make it a small incision. And because I have EDS, he felt a lot more comfortable doing it open instead of laparoscopically, just because my tissues are so fragile that he really wanted to make sure that everything was secure, and for him the easiest way to do that is through an open surgery. And so that's how he accessed my intestines, and then this thing right here is the J tube. So you'll notice this one is super long and big compared to my little GJ button. So the difference between my J tube and my GJ tube is that the GJ tube is a button, a low profile, and in order to access it, you use this little extension that sort of clicks in. But the dangler tube are used post-surgery to promote healing because the actual length of the tube is adjustable, and since you've just had major surgery, your stomach is super swollen and things are shifting and healing, and you can't estimate how long you need the feeding tube when it's first placed. You have to let it heal for a few weeks. And so I'm about 3 months post-op now. I still have this dangler tube because I've had a few complications with healing. But eventually, hopefully within the next week or two, I will be switching to a J button, and it will look almost exactly like the GJ button, but it will only have 1 port instead of 2. So surgery itself went pretty easy, but recovery has been pretty rough for me. So The initial, right after I woke up from surgery, was extremely difficult for me. I have a weird reaction to anesthetics, all anesthetics, where we haven't really diagnosed what it is, but it essentially appears like I'm having seizures for like usually about an hour as I'm waking up, but sometimes for much longer. And what happens is basically all my muscles will tense up extremely tight, including the muscles in my chest cavity, my abdomen, my neck, my jaw, everything, my entire body will tense up, and it kind of looks like I'm having an exorcism. But because my muscles are locked, including the ones in my chest cavity, I'm not able to breathe as I'm having these seizures, I guess, for lack of a better word. So that was really rough, especially because I just had open abdominal surgery and my body was constantly clenching and moving and like writhing around and I wasn't able to breathe properly. But unfortunately, because it's not diagnosed and it's a very, very rare reaction, it's very confusing. The post-op team was not very good at managing that reaction this time around. They sort of thought that I was having anxiety and that I was intentionally holding my breath, which I've had this reaction many times before, so the reaction itself I'm somewhat used to, but the scary part was that they were not understanding how serious this reaction is. In the past, it's become so bad that I had to be re-intubated, re-put back on a ventilator to be able to breathe. I was almost in the ICU a few times because of it. It's a pretty serious reaction, and it was very, very scary to have nurses telling me to stop doing that, stop crying, be quiet, we're not doing that. So that was really hard to hear, and this reaction lasted a lot longer because they weren't treating it like a seizure or a convulsion. They were thinking it was anxiety, so they didn't treat it properly. Normally, when they treat it like it's a seizure, it will pass within about an hour, and then I'll be okay and I can relax. But because they didn't give me any medications to stop these convulsions, it persisted for about 6 hours, and as you can imagine, it was extremely painful post-surgery. It got so bad to the point where I was very oxygen deprived, where I lost sensation in my arms and legs. I wasn't able to move them in between these episodes. Normally I'm able to talk and move normally, but this time I had been having trouble breathing for so long that my body lost sensation and I couldn't squeeze anybody's hands. I couldn't really talk. It was just really miserable. But finally it did calm down after about 6 hours, and so after that the pain actually wasn't too bad from the surgery itself. Obviously I was really sore from having these convulsions for hours on end. But the site itself, of course, was painful, but they definitely were able to manage it with medications and muscle relaxers and that sort of thing. And I actually was able to go home within 24 hours. So the initial recovery actually wasn't too bad. I know a lot of people have different experiences, but for me, it was not too bad. Unfortunately, after the initial week post-op, which went pretty well, I started having some complications. So the first one was an issue called dehiscence. I don't know if I'm saying that perfectly correct, but essentially it means that the surgical wounds were opening rather than closing and healing. So my open abdominal scar had a few little spots that were sort of pulling themselves back open. But the worst one was right at the J-tube itself. It was about a quarter size and it looked like someone had just scooped out my abdominal wall. You could see down to the fat layer. And and this hole was just ripping and ripping and ripping and getting bigger and bigger and bigger. It was not healing. There was not any visible change in it for weeks, and I saw my GI a couple weeks post-op, and actually she thought it was infected, so I went to the ER, and ER experience was also really bad. But essentially I got a small infection just because the wound was pulling apart and getting worse and not healing, and that's a complication that's pretty common with Ehlers-Danlos syndrome, which is the genetic connective tissue disorder I have, which means that the collagen in my body is really disorganized. There's not enough of it, and it's faulty. So all of the glue that's in all of your tissues is really weak in me, so my skin is really prone to tearing. It's really hard to stitch it together. It takes a really long time to heal, and so this complication was essentially just a result of having EDS. But it was very painful, as you can imagine, to have such a gaping wound for so long. It took about 6 weeks before I even started seeing those signs of healing. So that took a long time, and normally I don't think that's the most common complication to have, but it was essentially a superficial complication, so the inside and my intestines were okay and healing well. Just the outside skin and tissues were having a really hard time healing. And then at about 8 weeks post-op, so about a month ago, I started getting a lot deeper positional, like, pressure kind of pain, like inside of my body rather than that superficial pain from the dehiscence, which had been starting to heal at this point. And so I called my surgeon, and again they told me to go to the ER, and there we learned that I had an abscess where my J-tube was, and that was causing pain. And so I was admitted, and then I was on IV antibiotics for a few days, and then went home on antibiotics. And so that has finally cleared up now, but that was just another complication I had, and again was really painful. And then most recently, again, because I have EDS, my tissues are really, really stretchy. And so the other day, probably a week or two ago, I was having a lot of pain right at my J-tube. And so I looked down, and I actually saw the inflated balloon coming out of my abdomen. But this little plastic thing inflates, and it kind of looks like a donut around the tube. And so when it's inflated, it won't be able to pull through your abdominal wall. But the other day I looked down, and I actually saw the inflated balloon coming out of my abdomen, which means that the tract that my surgeon made with my own intestines had been experiencing this stretching and pulling so much that it actually pulled the balloon through. And so that's just another issue I've had. But I will say, going into J-tube surgery, my biggest concern was actually that I would have a poorly healed stoma site that was too loose. So of all the horror stories I've heard about J-tubes, the biggest and most common issue I've heard is that the stoma, again, or the hole that the tube sits in, doesn't heal tight enough, and it's very loose. And if that happens, things will leak out of it like stomach acid, and on your skin you can get acid burns that are extremely painful, and I just was really scared of that happening. But thankfully I have not had that complication, and I actually think it's a little bit due to the fact that the initial dehiscence happened. It formed so much scar tissue right around where the J-tube was that it's actually healed extremely tightly. And it's really, really hard. It's not stretchy at all. It's like concrete tissue around it, which means that switching out this tube is going to be very painful. Moving it around is a little bit painful, but it's not leaking at all whatsoever, which is such a huge blessing because I've had acid burns before, and it's so terrible. It was literally the thing I was most scared of. So overall, even though I've had quite a few complications, I feel really thankful that mine has actually healed very well compared to a lot of people. So in that regard, I think once I get over all these hurdles of the initial healing complications, my J-tube I think is actually going to be very successful overall, which I'm very glad for. So overall, do I regret getting a J-tube? No. Obviously, I wasn't really at a point where I could not have access to my intestines, because otherwise I would still be in the hospital. My J-tube is the only reason I'm able to take medications that aren't IV or other forms. So it's the only way I'm able to take pill medications. So that's extremely important and definitely has kept me out of the hospital and stable and healthier than I would be otherwise. But yeah, that I guess was my J-tube story time / explanation. I will hopefully in the future do a bit of an update video once everything's sort of healed and settled on just how my experiences and just more in-depth and hacks and tips and tricks and all of that kind of stuff. But for now, thank you for watching. I hope this kind of was a little bit informative, but also sort of explained why I now have 2 feeding tubes. And yeah, thank you for watching, and I'll see you guys in the next one. Thanks guys, bye.